We face three major burdens or challenges with malnutrition. The first is the very familiar problem of hunger, of people not getting enough dietary energy, which is usually from cereals. The second major problem which we have is micronutrient deficiencies, not enough minerals, not enough vitamins. And this affects human life in very, very profound ways. Many women and children, for example, suffer from anemia and related problems. We also have a third problem, a problem which has grown in recent decades of growing diet-related non-communicable diseases. This is often manifest in problems of obesity, but there are, of course, problems of non-communicable diseases which are not necessarily related to people being overweight. There certainly is enough food right now to feed everybody in the world. The problem, however, is that our societies are unfortunately rather unequal societies, and many people suffer from undernutrition due to inequalities. Many people, for example, are chronically hungry in many of our societies because they do not have enough access to food. They either do not produce their own food or they do not have sufficient incomes to be able to afford the food which they need. Also, it is often seen as easier to deal with problems of inadequate dietary energy, of undernourishment as it's often called, without addressing the problems of micronutrient deficiencies, for example, which are so crucial for cognitive as well as physical development, especially in young children, but also with people throughout the life cycle. One of the big problems with governance as far as nutrition is concerned is the fact that in most governments, nobody feels directly and principally responsible for nutrition problems. And the result is that there is no sense of ownership, of great responsibility for leadership in handling nutrition. Very often, governments may deal with nutrition in health ministries, and that leads to a tendency to medicalize malnutrition, to try to overcome malnutrition through supplements. There's also a problem of dealing with education. Education is crucial if people are going to realize problems of the sources of malnutrition and to overcome them. We are often also confronted with problems relating to changing popular culture, related to urbanization, people being further away from the food sources, for example. There need to be a number of targeted initiatives. The international community increasingly recognizes that the first 1,000 days from conception to the age of 2 is especially crucial window for intervention, and some people would argue that the second 1,000 days, in other words, the first 2,000 days are crucial. In other words, until the age of about 5 or so, when presumably the child enters school. Schools can play a very, very important role, not only in creating greater consciousness and awareness of hygiene and good sanitation, and especially of good nutrition, but it is also important in terms of the possibility of having school feeding programs. We have changed our lifestyles over the decades. People are involved in much less physical activity than they might have been in times past. And as a consequence of that, less physical activity as well as eating more than might be necessary, we have growing problems of obesity and overweightness, which impose tremendous burdens on societies, tremendous burdens on government spending, and tremendous burdens in terms of the ability of families as well as communities, as well as entire national societies to cope with these problems.